excited. We have Dr. Saharia with us. He is a highly skilled and renowned transplant surgeon with Houston Methodist Department of Surgery. He is also the director of liver transplant at Houston Methodist J.C. Walter Jr. Transplant Center. Dr. Saharia has 15 years of experience in liver transplantation and specializes in surgical oncology with a special interest in pancreatic cancer. Wow, doctor. You have amazing, your resume looks amazing, and your work over 15 years. So we're so excited you're here to share information with us, and thank you so much for the time. So let's begin. What causes the disease, right? Before we get into transplantation, we want to know from you what causes liver disease.
Okay, I'm going to take this opportunity to divide my talk into liver disease, kidney disease, maybe a touch of lung and heart disease, because transplantation is my field. Mostly transplantation is what I do. So I'll start with livers first, because livers is something that I do mostly. I do some kidney transplants too, but I do mostly liver transplants. I'll start with livers. So let us talk about what causes liver disease and what makes people sick enough to need a liver transplant.
Right.
So the most common reason for people to have liver disease in current world is actually alcoholic liver disease. So, we have, everyone drinks alcohol, and just that's the thing in the community. That's one thing. Then of course there is hepatitis C, which now has a treatment for. So not as much hepatitis C, but hepatitis B is another thing that people can acquire hepatitis B, which is an infection.
Okay.
And then of course some autoimmune disease, like my body is attacking my organs. So my immune system is attacking my organs, like for example an autoimmune process like autoimmune hepatitis, which is liver being attacked, or something called PSC, which is again the same spectrum of autoimmune diseases affecting the liver. So vast majority, I would say, the reason why people land up with liver disease is alcoholic liver disease, then is the hepatitis and the autoimmune processes.
Okay, and what can we do to prevent this disease? Is there anything under our control?
So for sure, we all know how to prevent alcoholic liver disease.
Yeah.
But if we talk, I'll come back to it in a second. But I want to touch on hepatitis B and hepatitis C a little bit.
Okay.
For hepatitis B, there is vaccination, and this vaccination is universal. Every kid who's born, at least in this country, gets hepatitis B vaccination.
Yeah.
But hepatitis B is very common in the Asian part of the world, and it's getting better. There is also something called vertical transmission of hepatitis B, which means that it passes on from mother to child. But vaccinations have definitely helped. The world is different now. Hepatitis B vaccination is almost universal.
Yeah.
And we need to get boosters for hepatitis B, because sometimes we will check people for hepatitis B vaccine. They said they've had hepatitis B vaccine, but their titers are not high enough.
Okay.
And hepatitis B can be transmitted through blood transfusion, and through tattoos, through sexual contact. So all this the transmissions can happen through different routes. And similarly, hepatitis C is like that.
Yeah.
Hepatitis C does not have a vaccine, but hepatitis C has an excellent treatment now.
Okay.
So, and the vast majority of people who have hepatitis C right now don't even know they have hepatitis C.
Oh.
So the way to really know that somebody has hepatitis C is to get yourself checked. So when you go to a doctor, you order some blood tests, and hepatitis C is never part of the spectrum. So you'll get, I'll get my kidney function, I'll get my hemoglobin, and I'll get my liver function, but nobody talks about hepatitis C. But if you check people, if you specifically ask your primary care physician, hey, can you please also check me for hepatitis C? Because, I had immunization back home, and, I don't know if the needles were sterile at that time, and hepatitis C was common. I don't know if I still have, I ever acquired hepatitis C through it. But if someone has had like tattoos done, or know that they've had blood transfusion in the past, it's probably the best to get yourself checked for hepatitis C. And the third thing is autoimmune diseases. Autoimmune diseases, unfortunately, there is no way to know about autoimmune diseases. An autoimmune disease is something that we can only know if you do a blood test and your liver function is off.
Okay.
So that is something that can only come through blood tests.
But so is that a regular test that an MD?
Yes.
MD does?
So
Okay.
when you go to a primary care physician, they'll definitely check you for your LFTs, which is your liver function test,
Okay.
and your liver function test are okay. You're
Yeah.
pretty sure that you don't have an autoimmune disease
Yeah.
or kidney disease.
Yeah, because I just had one, so that's why I'm asking.
Yeah.
Because I remember her saying something about my kidneys functioning fine,
Yeah.
and she must have said liver. But
Yeah.
I guess for me, kidney is more of because my father-in-law
Yeah.
passed away with it,
Yeah.
so I pay more attention.
No,
to
definitely.
that.
We'll
Yeah.
talk about kidney transplants or kidney
Yeah.
diseases in a second.
Yeah.
But let me just focus on two important things which I want to really focus on for the liver disease to develop.
Yeah.
So one is alcohol, but I didn't fail to mention one is called NASH, non-alcoholic steatohepatitis, which is essentially people who have obesity and whose cholesterol is high and they have diabetes. So these three things together, if they occur, it causes a disease in the liver called fatty liver disease.
Okay.
Fatty liver disease is one of the biggest causes of liver disease right now.
Oh.
And most of the people, actually, I know in my community, my brother has fatty liver disease because he just eats a lot of carbohydrates. He's not a diabetic, but he's slightly overweight, and so that is something that I am always on him to try to lose weight, not
Yeah.
eat a lot of sugars and carbohydrates, and be very careful about his diet. His liver function tests are slightly elevated, but if you look at all my patients who have cirrhosis, have had that history for 10 years, and 10 years later they develop cirrhosis.
Okay.
Cirrhosis is end-stage liver disease. That means you're done with your liver. This liver needs to be changed. So whoever is a diabetic, slightly overweight, cholesterol high, become extremely careful that 10 years down, you're likely to develop cirrhosis. So it is something that we need to be extremely careful about. And weight loss is the best way to control fatty liver disease. And if somebody has, weight loss doesn't mean like I'm going to go in like 3 months, I'll be down. That doesn't work. Actually, it make it your liver worse. So you want a weight loss which comes in your lifestyle. I will consume low calories. I'll have more self-control.
Yeah.
I will not put myself in a situation that'll make me eat more.
Yeah.
Person like me, I reach home. If I have food sitting on the table, I will start eating.
Yeah.
And so I tell my wife, please don't have anything on the counter because as soon as I enter, I will start eating.
Yes.
So that is the system. You develop system. You know, I can work on my self-control, but self-control ends very quickly.
Yeah.
So the system of the house says, okay, you know, we will lead a healthy life, and healthy life means having a system. And I don't have to exert self-control all the time. If my house is geared towards a healthy living,
Yes.
and if I have talked about it with my family multiple times that, you know, I have very little self-control on food, please don't keep food on the counter, then, you know, it'll start happening.
Yeah.
So I would suggest to everyone, and it also starts at the grocery store. If I'm not buying, so my and I'm not going to keep blaming on her. It's just that it's like if we have like chocolate sitting at home, whoever may have bought it, maybe me.
Yeah.
I'm most likely, if I'm hungry, I'm going to pick up one.
Yeah,
You know,
yeah.
so it just starts at the grocery store. If we are very mindful that it is an epidemic right now. Everyone you do an ultrasound, you'll see somebody has fatty liver disease, and it's very easy to pick up fat on ultrasounds.
Okay.
So carbohydrate intake is the most common cause for this fatty liver disease.
Okay.
So I've talked about fatty liver disease. Now I'm going to talk about alcoholic liver disease. Alcoholic liver disease is a condition, obviously, clearly, as the name says, is caused by consuming alcohol. And but you know, you can say how much alcohol. It's very difficult to quantify, but we know that everyone is a little different. You know, I could have 2 drinks a day. It may be okay for me, but if somebody having 1 drink a day may be too much for them. And what is more important to know is acute alcoholic liver disease, that some kids, they will start drinking a whole lot because they're they're in college and everybody else around them are drinking, and then somebody will have something called acute liver disease. That means I drank too much alcohol and suddenly my liver is shut down.
Oh my.
And this happens
That's
because
scary.
actually we have examples of this happening from kids. Sometimes we'll get kids transferred from nearby colleges,
Yeah.
and they will come in a bad state of mind, because once your liver is shut down, you're not clearing toxins, your brain is cloudy.
Yeah.
So people don't know where they are. They're obtunded. They start turning yellow because when you have liver disease, you start becoming very jaundiced.
Okay.
And if the kids only knew in college that, hey, listen, it's okay to party, but be careful about drinking alcohol. If you are in a situation that is going to put you into a company of people who are drinking alcohol, I can guarantee you the kids will go and drink alcohol.
Yeah.
So the best thing I keep saying, create a system where you don't fall into a situation where you feel that it's peer pressured into drinking, or if you think that you have some mental health disease, it's not a stigma to have mental health disease. It is important to recognize that the kids go through a rough period, transitioning from home to college. You have to recognize some little bit of depression, a little bit of anxiety is very common. My son went through it. Okay. And there was a time where we had to pull him out of college just for his mental health, because it's important. Because if I didn't spend 6 months with my son fixing his mental health, he could have gone into drinking alcohol, which if I had recognized it, then I better act on it.
Yeah.
So it's important for your own health to do this. And so it's important for me to tell everyone that you have to be careful about mental health, which can lead to alcoholic liver disease. The kids need to be sure that they don't get into a company or a situation. I don't want to use the word company. I want to use the word situation. So you want to get into a situation where you will drink in large amounts, which can result in severe liver disease and can put you in acute liver failure, which will require, the only way to save a person like this is a liver transplant.
I'm so happy he spoke about mental health, because I feel like that is a subject, especially in our Desi
it's
community.
taboo. Who comes and tells that my son
exactly.
had mental
and it's
health
not
disease?
spoken about enough.
It's important to talk about it.
Absolutely.
Because if I talk about my son having depression, and that's why we had to pull him out of college, I'm as a physician, I want this word go out, because I want people to realize that it is a real thing. When kids go from home to college, it can happen. During COVID, you just don't know how these kids would, they had plans for their future, they have plans for how the college was going to look like. Everything was shut down.
Yeah.
Kids were not meeting kids.
Yeah.
It was an isolated situation. I mean, our kids, almost 40% of our kids are going through depression or anxiety. And we need to realize this, and we need to bring it out in the open so that we can actually get it treated.
Yeah.
Absolutely.
Get help.
I'm so happy you brought this up. Thank you.
Yeah.
But it is sad, right? Like, these kids are just beginning their life. This is just the beginning.
Exactly.
College,
and they had so much hopes for themselves.
Yeah.
And, it's just COVID did put a big
thing. Yeah, and if they're coming in your ERs and they need a transplant, then that's gonna be something that is gonna stay with them for a life. Yeah. So it is so important to even talk about
my normal life versus my life with the liver transplant is very different.
It's very different, exactly. So what can be done to prevent liver transplant or liver disease?
So again, 1, 2, 3, 4, alcoholic liver disease. Don't put yourself in a situation. Fatty liver disease.
Your diet
control, calorie control is. I want to use the word calorie control over diet control, because the calorie control means that you're mindful of every calorie that you consume. That if I'm putting food in my mouth, somehow in my brain I'm going 110 calories. And the reason people may say, no, that's stupid, shouldn't do it. But realize this, that fatty liver disease is present in almost 50% of us.
Oh.
we have to think that we probably have fatty liver disease. And if we have fatty liver disease for 10 to 15 years, we are likely to develop cirrhosis, especially if I develop diabetes. If I go overweight, I'm 52 years old and my weight is 185 pounds. Now, if I hit 190, maybe I'll turn diabetic. That 5-pound difference can turn me into a diabetic.
Can it be reversed?
It can be reversed.
Okay.
So you can reverse diabetes, fatty liver disease by 10% weight loss.
Oh, wow.
10% weight loss means my calorie consciousness and my exercise consciousness.
that's
So
what
if I'm able to, exercise, one word is like, hitting the gym. That's the more popular way of doing it.
Yeah.
But really, exercise just means that I need to be on my feet more than
Yeah.
on my
Yeah.
butt more. I need
Yeah.
to be walking more,
Yeah.
and I need to be taking stairs more than taking the elevators more. I
Yeah.
need to park my car
car,
distance,
yes.
and so just
Yeah.
little things will
But
add
also,
exercise.
I feel like, because you know how they say that 80-20, right? Like where 80% is of the food that you eat.
Right.
Yeah.
And 20% is the exercise.
Yeah.
So, like, I mean, I know a couple of people, in fact, my own husband, he exercises, he plays tennis, and he is very, athletic. But food, when it comes to food, and that's me
That's
too.
his
Like, we just kind of
weakness.
like, that's our weakness. Like, we don't drink or anything,
Yeah.
but food, when it comes to food, we're just like,
because the brain, the center for heroin and the center for sugar and food is the same. So what lights up in MRIs when you consume food and when you consume heroin is the same center of the brain.
Oh, wow.
Food is addicting. So you have to realize that food is addicting.
yeah, it is.
We don't need food, but we will still eat food because it's 2:00. It's breakfast time. It's lunch time. Sugars will
agree.
dip. We'll
Yeah.
run to food.
Yeah.
So, what's your intake on intermittent fasting when it comes to that?
Intermittent fasting is an excellent way. So your glycemic controls can be brilliant if you do intermittent fasting. You eat once a day. That's all. That's all. you
OMAD.
need.
1 meal a day.
One meal a day. Or you can reduce your timing of eating from 4 p.m. to 8 p.m. or from noon to 4 p.m. Something like that, so that you have very good glycemic control. Your sugars are not like crazy high.
Haywire.
Yeah.
Okay. Thank you.
Yeah, it's an excellent way to control your sugars and keeping your weight steady.
Okay.
Yeah.
Yeah.
And of course, calorie consciousness, not diet control, because diet fads come, diet fads go.
Yeah.
I could be eating only protein and fat diet or whatever.
Yeah, keto and then
keto
there's-
diet and whatnot.
Yeah.
The problem with keto diet is if I lose too much weight too fast, then my liver turns into, actually, believe it or not, rapid weight loss results in fatty liver disease.
Oh.
There are some mechanisms involved which is related to the ketogenic food or the ketosis that it causes fatty liver disease. So rapid weight loss can also cause fatty liver disease, which is that's why it is important that it is steady and it's not sudden.
Yeah.
So it needs to be a 3-year plan, not a 30-day plan.
Yeah.
Yeah.
So
Slow and steady wins the race.
still slow and steady is the only. If you say that I'm completely going to eliminate sugar from my diet and
I've tried that. Last for 2
Never
days.
never
Why can't
never
even do
works.
it? Yeah.
But if you say that I'll be conscious every time if I have like a piece of cake and I take only 2 bites of
Yeah.
it, that's doable.
Yeah.
I've had my satisfaction of my eating a cake or piece of ice cream, but I'm not having like 6 bites of the cake or 6 bites of the ice cream.
Yeah.
5 bites is okay.
Now, I have some friends who will actually, if they eat sugar, they will go and hit the gym right after because it's in their minds that I consume sugar. And so that calorie consciousness is important for us,
Yeah.
especially in this world. When you realize that 50% of us will have fatty liver disease, we better think we also have it. We
Yeah.
probably have some of it.
Yeah.
So we become calorie conscious, we become
Healthier.
health
Yeah.
conscious. Yeah.
Yeah.
Awesome. Okay.
Can I talk about kidney disease now?
Yes,
I'm
please.
going to
Yeah,
switch
that's
gear
the
pretty
one.
quickly. Yeah. Because I mean, I've done a lot of kidney transplants also. I'm do only livers, but I want to really touch on kidney transplant, and it just comes down to the same thing, your blood pressure control and your diabetes control, because vast majority of kidney disease is caused by either diabetes or chronic hypertension.
Yeah.
So, and again, diabetes is related to our diet. Is related, of course, it's inherited. You can inherit. You can have like whole family members having diabetes, but I can also be somebody who has poor glycemic control, which means my sugars stay high for half the day, and half the day it's normal. And that's bad for the kidneys, and it's bad for the liver. But if I have chronic hypertension, it doesn't affect the liver as much, but it definitely affects my kidneys.
Yeah.
And so these are the things that we don't need a doctor for. If I have a blood pressure instrument at home and my blood pressures are showing high on, if I check my blood pressure, say 5 times in one day, so I want to see what my blood pressure fluctuation is. Just have one day dedicated to, I'm going to check my blood pressure today, check 5 times and see how many times it has been high.
Yeah.
If it's been high for more than 3 times, that means you need treatment. So it's important to have those things in your mind, that high blood pressure can result in your kidneys failing after 10 years of having high blood pressure. And we don't need a doctor for it. We just need to be self-conscious for it.
Yes.
I don't need to visit my doctor. If I don't like going to doctors, fine, but at least I can check my blood pressure, and it's like a $30 equipment that you can get from Walgreens.
Yeah.
And blood sugar is, again, yes, it is important. It's hard for people to stick themselves and measure their sugars, but they can definitely have a system in place where they don't, grocery shopping is done correctly. That means we are very particular about what we pick. Our pantries are stored in such a way that we don't have like excessive
Guilty.
pick up food. You can have rice sitting at home, you can have wheat sitting at home, and I cannot pick up rice from a rice container and start eating unless it's cooked.
Yeah.
But if I have uncooked stuff, if I have like ready-made food sitting I'll pick it up and eat. Trust me, I will walk into the pantry when I'm hungry. I'll walk it,
Like
eat it.
we have chevra and puri and God knows what not. That's
Sitting
the
in
adults.
sitting in the pantry, right? It's like you'll walk in and I'm hungry,
Yeah.
I'm watching TV. Oh, the show is so exciting, but I need to take this 1 second break. I'll walk and
let me
pick
go
up.
grab some chips.
Yeah, grab some chips and come back. It's just, unfortunately, in this world where if we can see an epidemic of fatty liver disease happening, we better know that it's probably in me too. And if I'm not acting today, by tomorrow is going to be bad.
Oh wow.
Yeah.
But then how, I'm just thinking about our kids, right? If we're saying this about
Yeah.
ourselves, how do we both have young kids,
Yeah.
like 8 and 12.
Yeah.
So, how do we stop it? Because
That's
I'm
very
sitting
important.
in my pantry, I have
Yeah.
candies and
Yeah.
Milanos and
Exactly.
God knows what.
So, my wife is a pediatrician,
Oh,
and
wow.
that's all she does is talk about how we need to start it early. You don't want your kids not to have candy.
Eliminate it. Yeah.
But they need to be extremely aware
Correct.
this is very addicting.
Yes.
And if you make them aware of the fact that these are very addicting,
Yeah.
you will see your kids will automatically have self-control.
Okay.
But they need to know the downside of it. And you have to keep talking about it repeatedly. When you talk about it repeatedly, then you know that they will be aware of it. If you talk about, hey, I'm having this banana, it's 110 calories. Tomorrow, when your kid picks up a banana, it's like, I'm eating 110 calories. It's just a thing that you become calorie conscious for the family, and it doesn't happen if mom doesn't do it or dad doesn't do it. How do you expect the child to do it?
Yes.
Absolutely.
Yes.
Yeah.
So true.
And they will let you know.
Yeah.
And that
They
is
will let you
excellent.
know.
You want your children to point you out.
Yes. Yes.
Because then they're aware.
Yes.
Yeah.
You know
Absolutely.
there's somebody watching on you all the time. And that's also another system you can create for your husband or your wife or your kid, your family, your dad, your mom. It's like, it's okay to object.
Yeah.
Absolutely.
If I'm eating extra food, my wife should be pointing out to me, stop eating.
Yeah.
Absolutely.
And you should not take it as they being too controlling. You have to take it, this person wants my health.
Yeah.
It's wishing for
If
the
I'm,
better.
you're wishing for the better. And unless you have those families where the structure allows you to interrupt somebody's eating,
Yeah.
that allowing environment will have a healthy your kids will grow healthy.
Absolutely.
And they will be careful about it.
We're in conversation with Dr. Saharia. We were talking about the causes of the disease, how to prevent it, and now we're going to go to what is the transplant process, right? The worst come scenario.
Yeah. So what happens? So transplants is, of course, our last option.
Yes.
I've tried to prevent liver disease. I've tried to prevent kidney disease, or heart disease, or lung disease, whatever it was. I've tried whatever preventions I have. Now they have failed. Now we have a kidney that's in, person is on dialysis, or the liver has failed and now have cirrhosis, or I have lung disease and I have pulmonary fibrosis, or I have heart disease and I have heart failure. So
Yes.
reached a point where you cannot turn around and go back.
Unfortunately, yes. Yeah.
So if somebody has bad liver disease, and so the condition that develops when you have bad liver disease and the liver has failed is called cirrhosis.
Okay.
Cirrhosis means the liver that is otherwise smooth and soft has become really hard and knobby and nodular.
Okay.
So, and blood can barely flow through it, and so what starts to happen is people will have back pressure changes in the blood because blood's trying to flow through a liver that's so hard, and it starts backing up and then starts leaking fluid in the abdomen, so in the belly. So you start developing fluid collections in the abdomen on the belly. So my belly starts to grow and become bigger because of fluid, not because I'm becoming fat. It's just fluid starts accumulating, or water starts accumulating. Water starts accumulating around my lungs, my legs swell, my face swells.
Yeah.
Sometimes people vomit blood, or there's blood in the stools, or I get very jaundiced, or I'm confused all the time. I have confusion in my brain, and obtunded. I'm sleeping most of the day because I'm so weak. I don't want to walk. I don't want to get out of bed. That is what liver failure does to you. Now, once that has happened, then of course, we have to become more active. If I haven't been to a doctor and I've reached cirrhosis, I better go to a doctor now if I want to have some extra days in my life. So you go to the doctor, they will diagnose that you have cirrhosis by different tests. And once the cirrhosis diagnosis is made, then you have to go to a transplant center. Transplant centers are there are only 3 transplant centers here. Maybe there are 50 hospitals in the city of Houston, but there are only 3 hospitals that do liver transplants, or kidney transplants for that matter, or heart or lung transplants. So Downtown Medical Center is where you have Memorial Hermann Hospital, St. Luke's Hospital, and the hospital that I work at is called Methodist Hospital. That's where transplants will happen, nowhere else. So you have to go to the hospital that does transplants, and go to the transplant center, because every hospital which is in the medical center will have a transplant center, and our Methodist Hospital also has a transplant center. And you go to the transplant center, and then you basically will be seen by 5 different people. One will be a surgeon, which is myself, or somebody like myself who's a surgeon. A medical doctor, like for example, for liver, you will need a hepatologist. For kidneys, you will need a nephrologist. For heart, you'll need a cardiologist. For lungs, you'll need a pulmonologist. So you get seen by these doctors, the surgeon. Then you get seen by a social worker. Social worker is somebody who will assess your social situation. So if I have a job that's not going to likely to last for a very long time, or my family situation is such that I will go back into the same problem. Say if I drink alcohol heavily, and my wife or my other loved one is also drinking alcohol heavily, then my chances of stopping to drink is very little. So to break that situation, you need some social intervention. So you have social workers who help with that. Then we have financial workers who are basically looking at if I have correct insurance for this hospital. So there'll be so many times when we'll have somebody referred for a transplant, but their insurances are not contracted with Methodist Hospital, so we'll send them to St. Luke's, so we'll send them to Memorial Hermann, whichever hospital. We don't care.
Yeah.
What we care is the patient gets taken care of.
Yes.
And so what is more important is that we do the right thing. And so we will send whichever hospital is contracted with them. These contracts change every year with the hospital.
Yeah.
Every insurance company will reassess the hospital and say whether this hospital will do our patients or not. And if it switches from Methodist, Memorial, that's how the game is played these days. So whichever transplant center you've been to, You get your workup done, and then you basically go on the list. For liver transplant specifically, the scoring system is called the MELD scoring system, MELD. That stands for Model for End Stage of Liver Disease. And if my MELD score is high, that means I'm very sick. If my MELD score is low, that means I'm not that sick. If my MELD score is high, I will get an offer.
Okay.
If my MELD score is not high, I won't get an offer. So essentially, in this area, because there's such need for organs, such high need for organs, then you can only transplant people when their MELD score is super, super high. That means 70% of my patients are in the ICU when we do their liver transplants. They're on the ventilator, they're on dialysis, they're on using blood pressure medications to support the blood pressures. So they're so sick that they're out in the, like, completely comatose in the ICU, on the ventilator, on dialysis, just waiting to get a transplant. And that MELD score is something called a MELD score of 40. And that's when we know that they will start getting liver offers.
Yeah.
That means I know that almost 60% of my patients will die waiting.
Oh.
Not 60%, I'm sorry. Only 60% people will land up getting transplanted. 40% will die.
Okay.
If they're not proactive. So if I'm proactive, I will be aggressive in getting my treatment, or my family will be aggressive in getting my treatment. But unfortunately, the waits are such, or the level of sickness has to be so bad that I have to be in the ICU to get an organ. So that brings us to the fact that how do we increase the organ availability?
Exactly.
Yeah.
That's what I'm thinking.
Yeah.
Because it's not something you can
Right,
just go
you cannot
get.
go and get it.
Yeah.
So there are two ways to donate an organ. One is
Yes.
deceased donation, one is living donation.
Okay.
Living donation means that I have a loved one who needs a liver or a kidney, and I can give them half of my liver or one of my kidneys.
Oh.
But deceased donation, which is definitely more common in this country, if you go to like the East, like India, Pakistan, and Singapore, and Japan, Korea, there's all living donation. But in this part of the world, it's mostly deceased donation. So let me talk about living donation first. Living donation means that I am a healthy person, and I want my loved one, my wife, my husband, my dad, my mother, whoever it is, I want this person to live longer. So I'll give half of my liver or one of my kidneys to them. It's a very safe process. People do this all the time. If you go to San Antonio, I'll give you this example. It's a citywide phenomenon. And we can bring this to Houston also.
Yeah.
I admire people from San Antonio. I'll tell you why. They have the biggest living donor kidney program, and now they have the biggest living donor liver program. And the reason is a citywide awareness. It took them 10 years to become city of donors. So you take half my liver,
Yeah.
somebody gets to live. You take
Yeah.
one of my kidneys, somebody gets to live. It's such a safe process. Yes, you go through an operation. Yes, I have to go through pain of donating, and yes, I have to donate. And it's scary. It's scary for sure. But what is more important is to know that I'll be okay.
Yeah.
Of course, there are risks, and obviously no doctor is going to take the risk of having a donor have a problem. But if I'm healthy, I just have to be brave.
Yeah.
That's all. And if I'm brave, I'll be able to donate.
Yeah.
If I'm healthy and I'm scared, obviously I'll need to be educated that I really don't need to be scared, because it's okay to donate.
Yeah.
All I have to be aware is that people are in need of organs, and if I don't step up, somebody will lose their life.
Yeah.
So, and if it's my loved one, it's right at home, and I have this chance to save somebody, I should. If I have the resources, I should. So that is living donation. Then deceased donation is also something we have to talk about. Deceased donation means that I was in a car accident and I have a bad head injury and I'm brain dead. If I'm brain dead, my family can be asked, hey, ambulances pick me up from the scene of crash, they take me to the hospital, and I have no brain activity left, but my oxygen was supplied because I was intubated on the scene. That means the paramedics intubated me and they took me to the hospital, and they put me on a ventilator. So my breathing is going on because of the ventilator, and as long as breathing is going on, your heart will beat. Now, just a quick example. Now, if you try to hold a breath and just try to take a deep breath and hold it, you can do it, right? Because your brain controls your breathing. If I'm brain dead, my breathing stops. Now try to stop your heart. You cannot stop your heart.
I'll say, wait a minute.
Yeah, you cannot stop your heart because heart is autonomous. That means it's beating on its own.
Yeah.
But breathing, to some degree, is controlled by your brain. So if I'm brain dead, my breathing will stop, but my heart will keep beating till I've stopped breathing for more than 5 minutes. And then finally, my heart will stop beating. So if I get intubated on the scene, intubated means on the ventilator on the scene of say, a motor vehicle accident, and then by the time I reach the ICU and the nurses assess me, I'll say, okay, this guy has no brain activity. He has no brain blood flow in his brain. Then they'll call LifeGift. LifeGift is an organization that assesses donors for suitability of organs. So they call LifeGift. LifeGift says, okay, this guy's kidney is working okay. His lungs look terrible because he had lung injury, but his heart looks okay. And so let's send out a request to the family to see if the family wants to donate. And if my wife comes in and says, no, I'm too attached to him, and I'm all brain dead, I have nothing left. But she's, oh no, I'm too attached to him, I cannot let him go like this. Although because she sees the monitor, sees my heart beating, and it is wrong. I have no brain activity left. There is no me left. It's just the heart that's beating. So people need to realize that brain death is death. It's not heart death. Heart stops beating after 5 to 6 minutes of no breathing.
Yeah.
But my brain's dead, I'm gone. There is nothing left of me.
Yeah.
You can keep me on the ventilator for 2 months, but there'll be no me coming back. Okay. So if people realize that giving acceptance on your driver's license to donate an organ, then you're legally an organ donor. No matter what my wife says, no matter what my son comes and says, no, I'm not going to give his organs. But if my license says that I want to donate my organs, then they'll set a court and they'll fight my wife or my son to say, hey, no, your dad wanted or your husband wanted to donate his or her organs, and you better accept his last wishes.
Yeah.
If you don't, then the court will interject. So I think the best way to do it is that we all become donors.
Yeah.
When we all become donors, then these organs, which are of no use anymore, will be utilized by somebody.
Yes.
And it's a very good way to let somebody go. So if I'm 50 years old, tomorrow I die, I'm always like, oh man, he died at 50,
Yeah.
But you know what? My organs will live through somebody else. So it's something getting good out of a bad thing happening.
Yes.
So it is important to realize that organ donation has a positive part to it. If I have a loved one die early, it's very, very sad, but I can get something positive out of it by seeing somebody else live through his or her organs.
Yeah.
So that is why it is important to be a donor. It is important to put that checkbox on your driver's license, say, I want to donate. There's no scary left because I'm dead. What am I going to do with my organs? So let somebody else have a life if they want to live. So that is organ donation. And the transplant process, then, what happens is once the operating room timing is set, somebody will come and, a person will come from Iowa to take my heart. Somebody will come from Dallas to take my liver. Somebody will come from Tennessee to get my kidneys. And the 4 different teams will come at the same time. They'll acquire the organs at the same time, and they'll fly out and utilize those organs. And then my body basically goes to a morgue or something, and families do their last rites and they're done. So that's how the organ process for deceased donation happens. And but living donation we talked about, and deceased donation, that's the process. And then whoever gets the organ, they continue to have a good life.
Yes. So that's what we want to talk about, right? Like once they get the transplant, be it liver or kidney, like what are their survival rates, and then how do they take care of it?
So let's talk about like 4 organs. We'll talk about liver, kidney, heart, lung. So liver transplant, say say I have liver failure, I will be in the ICU on the ventilator and whatnot, and then now the roles have changed. I'm not the donor; I'm the receiver.
Yeah.
So if I'm about to get a liver transplant, I'm in the ICU. My family gets excited when there is an organ suddenly becomes available, and then I go to the operating room. It's like a 7-hour operation. The liver transplant is done, and then I spend some time in the ICU recovering, and then I go to the floors where I spend some more time recovering, and then I go to rehab to get stronger, and then I basically go home. It's like a 2-3 month process of getting stronger.
Oh, wow.
Yeah,
Okay.
for liver transplant, because liver transplant is people are a lot sicker.
Okay.
Then I have to take immunosuppressive medicines, which are suppressing my immune system, because you don't want my immune system to attack the new liver
Yeah.
that I have, and then I have to take it all my life.
Yeah.
Liver is a very hardy organ. It does not require a lot of immunosuppression. It'll continue to live. If I have lived with a liver transplant for 5 or 7 years, I probably need very little immunosuppression, because my body has become used to the new organ, and I have to take like a very little dose, maybe 1 or 2 tablets a day, and I'm done. I'm okay. Kidney transplants, let's talk about that for a second. Kidney transplants, say I've been on dialysis now for 5 to 6 years, because it's that long. It takes that long to get a kidney.
Yeah.
So I have to be on dialysis for 6 years and be alive for 6 years before I'll get in. And that's how it is in the entire country. Actually,
But is there an age thing too? Like, do you have to be under a certain age, I would think?
so yes, there is an age, but it's more about functionality. Say if I'm
Okay.
my transplant center says no kidney transplants after say 70 years of age.
Yeah.
That's not true. I mean, actually, we will transplant people up to 75. If I am somebody who exercises every day, I go to work every day, and I'm also doing dialysis,
Yeah.
what's wrong in transplanting me if I'm 75?
Yeah.
You know,
Okay, yeah.
I am a functioning member of the society. Please give me a kidney if
Yeah.
there's a kidney available, and there's nothing wrong with it.
Okay.
There is no cutoff age because I'm 75. I may be a 50-year-old who's bedbound, who has not walked in a year and a half. I have one leg amputated. I cannot think straight. I've had a stroke. Of course, don't transplant me, because
Yeah.
so what? I'm 50, but I have had a stroke. I have one leg amputated. I cannot get out of bed. What quality
Yeah.
of life are you trying to add by giving me? So
Yeah.
age is not a great cutoff.
Okay.
What is more important is how functioning I am. If I'm functioning, please give me
Yeah.
an organ.
Okay.
Yeah.
There's still some life left.
Yeah.
There's life left. I have if I have enthusiasm, if the rest of my body works, please give me a kidney transplant.
Yeah.
Yeah.
It's going to change my life. I'll have to stop going to dialysis. And if I do hemodialysis, then stop going to the centers. If I do peritoneal dialysis, then I stop hooking myself to the machine every night.
Yeah.
It's a difference in quality of my life,
Yeah.
and it also extends my life.
Yeah.
So that's kidney transplants. I'm not a heart or lung person, but I want to talk about it. So again, lung transplants are not a very common procedure in the United States. It's out of all the transplants, the least done is small bowel transplant, but the next is a lung transplant. It's just that it's just maturing. It's a newer transplant. But the common cause for lung transplant that we all need to be aware of is acid reflux. Acid reflux, which a lot of people have, they'll have belching and whatnot, and nighttime they'll have heartburns and whatnot. So we need to be aware that if you have bad acid reflux and you have silent aspiration happening at night, you have small amount of acid going from your esophagus into your breathing tube. Over 10 years of silent acid reflux, may develop something called pulmonary fibrosis. That means my lungs may become hard and the breathing becomes an issue. And then I need a lung transplant. So that is prevention of lung disease. One of them really is prevention of acid reflux, or making sure if I have bad acid reflux and when I sleep with at a slightly reclined position, that I'm not completely flat in my bed sleeping. And heart failure is obviously, people get heart failure from most common causes, obviously, bad heart attacks. People have had myocardial infarctions, which is a more scientific way of saying heart attack. If I've had heart attacks and affected my parts of my heart, and my heart doesn't squeeze really well, so usually your what is called ejection fraction should be less than 20%, and that means my heart's barely doing its job. I have to kind of stay in one place, because if I get and start walking, I'll get short of breath. And heart failures usually happen, again, diabetes, chronic hypertension, and heart attacks. And sometimes it's myocardial problems coming from viral diseases. People can have viral diseases causing cardiomyopathy. That means just heart problems not related to heart attacks. And then I need a heart transplant. So these are a lot of things are preventable. So we should talk about prevention more than reaching transplant. Because transplant is the very last thing you want to talk about.
Right. Yes. I can't believe the time's almost up.
Okay.
But we wanted to, what is your message? If you wanted to give one message, what would you like to share with the listeners?
Two things. One, have a system in the house which says, I'm okay stopping you from eating too much. Mm-hmm. Don't stop eating sweets or enjoying a good meal every now and then. But if you've had a good meal, just be careful.
Yeah.
Calorie counting. Mm-hmm. Don't get enamored by exercise gyms. Just add more daily activity.
Yeah.
2. 3, please be a donor. Whether you're a living donor or you want to donate your organs after you're gone, please be a donor. Please go, next time you get your license renewed, please have that organ donor on your license. Okay. And be aware of fatty liver disease. Mm-hmm. Be aware of alcoholic liver disease, especially kids. Yeah. Be aware of mental health, especially kids. Yeah. Teenagers going to college, just reach college, change the situation. And lead a healthy life, and that is the message. If somebody wants to hear one message, is just try not to find me anywhere. Don't ever have this surgeon be a surgeon ever. So
that's true.
Yeah, stay away from people like us. Yeah, that is the message.
In a good way.
Yes, in a good way. Thank you so much. This is personal to me and Sasha because both our father-in-laws passed away with kidney malfunction. So we really appreciate you sharing the information and giving us hope. I know it's not to scare, but to create awareness.
That is most important.
To create awareness.
Everything can be scary if you don't know about it. You know, if sometimes I wake up in the middle of the night like, what is that noise? Turns out it's the washing machine. So if I'm not aware, I'll be scared.
Yes.
You know?
Yeah. So yes, thank you so much, and we really appreciate the time, Doctor.
No, thank you very much for having me.
Thank you, viewers. We'll see you same place next time on Monday. Thank you. Bye-bye.